8:42. Welcome back. As a new month begins, a reason to remember to care for your heart. February is American Heart Month, and this morning we're talking to Dr. Frank Contacessa, or Dr. Frank, as he is well known by. Dr. Frank, good morning. How are you?
Good morning, Erica. How are you today?
I'm good. Thanks for being with us. All right, we really should be aware of our heart health all year long, but February is a time to sort of evaluate what we're doing, to take a good look at ourselves and our habits, and how can we reduce our risk of heart attack and heart disease, especially in the age of COVID?
Sure, and that is especially important in the age of COVID. You know, heart disease is certainly linked to things like obesity and diabetes, and one of the biggest risk factors with COVID has been obesity. So if we look at heart risks, there's a couple of risk factors that everybody should know. And there's some really important cardinal ones, and that's age over 50, high blood pressure, smoking, diabetes, and a strong family history of heart disease. And if you have these things, number one, it's important to get to your doctor and get a physical so that he can check your blood pressure, check your cholesterol, and really evaluate your overall health. What you can do on your own is really look at your lifestyle. If you're overweight, look at your diet. If you're not exercising, that's important to do as well. So there's sort of like a global thing that you can do is number one, check in with your doctor. And number two, look at your lifestyle. I always tell people when you're trying to improve your lifestyle, you should look at the worst thing that you're doing first. It's the low-hanging fruit, I call it. So pick the very worst habit. If you're drinking a lot of sugary soda, if you're smoking, if your diet is poor, pick that one thing, excuse me, and really try to work on that. And if you can improve that, you'll be farther ahead of the game. And then you can work on your next worst thing that you're doing.
I know losing weight is one of the best ways to reduce risk. What would you say is the best way to do that? Do you have any tips?
Eat less, move more. People get really confused about how to lose weight. It's a hard thing to do. I've had so many people during COVID, during the lockdowns, and people at working from home, and their desk is right next to the refrigerator. Many people have gained a lot of weight. Their lifestyle has really suffered. But if you really break it down, it's pretty simple. It's calories in versus calories out. There are only two ways to move the equation. You either eat less and move more. That's really the only secret. Diet drugs really are not the way to go. Fad diets don't work. You have to make lifestyle changes that are sustainable. People go on fad diets. They'll say, I'm going to eat zero carbs, zero sugar. That might work in the short term, excuse me, but overall, in the long term, you have to make choices that you can live with. I talk to people all the time. It's like, yeah, I lost 10 pounds 6 months ago. What happened? Well, I got tired of that diet and I kind of went back to what I was doing. Lifestyle changes have to be sustainable. Never pick something to do as a change that you can't live with.
I have to ask you, what should women keep in mind specifically when it comes to heart health?
Well, I think a lot of women, people always think about heart attacks as sort of like a man's disease, and it's really not. Excuse me again. The incidence of heart disease in women is pretty close to that of men. So for women, it's just as important to look at family history. A lot of times women forget that, if you had a father who had a heart attack in their 40s or 50s, that's a sign that you have to be a little bit more careful. There's another one thing I'd like to get out there too. There's a screening test that has become very popular lately that I'm doing with a lot of my patients that most people don't know anything about. It's called coronary calcium scoring. So this is basically a regular CAT scan. It's just a limited CAT scan of the heart. And what it does is look for calcifications or buildup of calcium in the walls of the coronary arteries. And this calcium buildup is linked to atherosclerotic plaques, blockages in the coronary arteries. And you get a score, a number. The best score is 0. The higher the score, the higher your risk. And it's really nice to be able to stratify somebody who comes in and has a lot of risk factors. And you do this test on them, and sure enough, they have a high score. And it allows us to be more aggressive with medications, having them see a cardiologist, do a stress test. Sometimes you get somebody who has a lot of risk factors and they come out with a score of 0. And you say, you know what, you didn't get that gene. And you're pretty lucky. You should still live a healthy lifestyle, but your risk isn't as bad as we thought.
Now, who can get this test? Do you have to be at a certain age? Do you have to have a certain number of risk factors in order to get the test done?
So number one, it has to be ordered by a physician. So you have to see your doctor. He has to give you an order for the test. Typically, I do this on people with 2 or more risk factors. And here's the catch. A lot of insurance companies don't want to cover it. And the reason it's become more because Medicare doesn't cover it, but it's become more popular because it's become less expensive. The test, depending on where you live, runs between $100 and $150,
Okay.
which, you can go out to dinner and spend that. It's
That's
not a
not that bad.
$1,000 test. It's not that bad. And the information that you get from it is extremely valuable. It's extremely accurate. And it really can stratify you and say, you know what, I'm at a higher risk. I really have to be careful. I have to get onto blood pressure medicine. I have to get onto cholesterol medicine to reduce my risk. Or it could be a peace of mind and say, you know what, even though my father had a heart attack at a young age, it looks like I got mom's genes.
All right, Dr. Frank, thanks so much. A lot of really good, important information. I think people are watching this. You should just be mindful of seeing your doctor regularly, right?
That's the most important thing. Keep in touch with your doctor. Have a good relationship with your doctor. Always be open.
Yeah, don't put it off. All right, Dr. Frank, thanks so much. We do appreciate it.
Thank you, Erica. Have a great day.
You too. Have a great day.